You're watching CTOM TV. Knowledge is power.
Now, in standard treatment, Alex, we have three main options. There's chemo, radiation, and stem cell transplant, and there's a little bit of detail coming up on each one of those. So talk us through that.
Yeah, so standard treatment for lymphomas has not changed in a long time, and that's because for most indolent or low-grade lymphomas, it's quite effective. The standard is what we call CHOP. It's a drug called cyclophosphamide, which is a very, very old drug. It's a microtubule inhibitor. Another drug called doxorubicin, another older drug, vincristine, and then the steroid prednisone. There's another alteration of that is relatively newer, and it's where they just use cyclophosphamide, vincristine, and prednisone. So most mature B cells express something called CD20. This is referred to as cluster of differentiation 20. And CDs are molecules on the outside of cells that help define or explain what type of cell that is and what its purpose is. So in this particular case, it's CD20 is the target of a drug called rituximab, which is a monoclonal antibody that binds onto any CD20 positive cell and then causes it to be broken down and killed. It's often used with CHOP, so that would be referred to as R-CHOP, rituximab, R, and then CHOP. And then there's also radiation therapy. And then for patients that have a good response, they can often go on to a stem cell transplant. So there's typically they're what we call autologous, which is a self, uses your own cells. And then there's also allogenic, but they're not really used very often.
Okay.
So most of the stem cell transplants are self-autologous.
Okay, so if I heard you right, most people with lymphoma have the easy to treat kind, and so standard care actually works quite well for them.
For a while, yeah, definitely.
For a while, okay.
Thank you for watching CTOM TV. Subscribe below and stay informed.